All right, ladies and gentlemen, gather round. We are going to talk about cardiovascular risk factors for women, specifically one. We know, for example, that when we go get assessed for cardiac health, our heart, whether or not we're at risk for a heart attack, there are certain criteria that we look at. So whether you have hypertension, high blood pressure, diabetes, family history, smoking, high cholesterol, those are things that we assess to see, okay, are you at risk for a cardiac event? A few months ago, I heard about this one risk factor that isn't included in the guidelines. And I thought, is this true? Is this real? Or is this fake news, right? Is this bullshit? So whenever I present anything to you guys, it's usually backed by science. So when I was at the National Menopause Conference on the weekend, multiple physicians brought this risk factor up as saying that it is, in fact, a risk factor for cardiac health and an indicator for cardiac health. And that is hot flashes. And like I said, I heard about this months ago and I was like, okay. But then they said, absolutely. Talking about intensity of hot flashes, really intense hot flashes, and also adding duration of length of time of hot flashes. How long are you having them for? Those should be included in the risk assessment. My question is why is nobody talking about this? Like I said, I heard it in the world months ago, but now it's confirmed. Yes, this is a risk factor. And I think it should be added. And when I went to my physician a couple of weeks ago to be assessed for cardiac risk, hot flashes never came up. How long I've had them or duration. And I think that's important to add. So I would love to know from my physician colleagues in the world, what are your thoughts on this? And are you going to add it to your conversation? I would love somebody to stitch it. Tell me. I want to know. Have a great day. We'll see you next time.